With vaccines including updated bivalent immunizations that tackle the latest and dominant Omicron strains, antiviral drugs coming on board in addition to testing, the UN chief believes that combined, these measures offer a clear path to preventing deaths and out of the pandemic.
We must close the booster gap. Vaccine booster coverage remains low everywhere, but low-income countries in particular are still struggling, with only 35% of healthcare workers and 31% of older populations fully vaccinated and boosted. Our top priority continues to be getting vaccines into arms. This must include addressing the shadow pandemic of vaccine hesitancy and countering misinformation with life-saving facts. Second, we must close the testing gap. Testing rates are plummeting everywhere, exposing the world to potential variants and undermining the rollout of new treatments. Giving these new medicines a chance means dramatically expanding testing and treatment coverage, especially for low and middle-income countries.
The United States and the United Kingdom are among countries that approved 2 bivalent or updated mRNA vaccines from Pfizer-BioNTech and Moderna that contain 2 messenger RNA components of the virus, one for the original strain and the other in common with both the BA4 and BA5 lineages of the dominant Omicron variant, a possible game changer in ending the pandemic if access and uptake meet the moment. While Guterres called for the pandemic preparedness gap also to be addressed.
Now is the time to strengthen our defense against future threats by investing in early warning systems, local manufacturing and diagnostic capabilities, and a well-paid, well-supplied health workforce. We must never be caught so unprepared again. It's time to build political momentum to finish the job on Covid-19. Let's get it done. Let's end this pandemic once and for all.
The WHO chief calibrating earlier comments that the world has never been in a better position to end the pandemic.
We have the tools to bring the acute phase of this pandemic to an end, but only if we vaccinate all health workers and older people, keep testing, and expand access to effective antivirals. That doesn't mean the virus will go away. It means countries will be able to transition to managing it alongside other respiratory diseases.
With global deaths just 10% of what they were in January 2021, light at the end of the tunnel, but a collective effort shaped in solidarity still required to get everyone over the finish line. Siobhan Ricepies, SABC News, New York.